Hello, my name is Tracy. I'll be your nurse today. Can you tell me your name and your date of birth?
It's Crystal, 10/11/76.
Okay, so I wash my hands. So I have to do a head-to-toe assessment on you today. Is that okay?
Yes.
Just some general questions and looking at some stuff?
Yes.
Okay, so first general appearance. Patient appears well kept, clean clothes, clean shoes, no issues with bathing. So just to start, I'm going to start with your head and then I'm just going to work my way down, okay?
Okay.
So first general appearance, hair looks good, clean, no lesions, no scars, no bruises. I'm going to feel okay?
Yes.
No lumps, masses, bruises, anything like that. I'm going to start with your lymph nodes and work my way down.
Okay.
Thank you. Tell me if there's any pain, okay? None of her lymph nodes are palpable. Patient does have a scar right here on the shoulder. Did you have a surgery or something?
I had had something removed. Hold on, I'm trying to remember. Lipoma, I think is what it was. Yeah.
Any other surgery history, just so I know before I get there?
Yes, I had a partial thyroidectomy. I had surgery on my back, gallbladder. I've had all kinds of surgeries, so I got scars all over the place.
Okay. So looking at her face is symmetrical, no unevenness. Can you smile for me? Smile's even on both sides. Eyes, can you follow my finger? Just your eyes, not your head. EOMs are good. Now, typically, if I was doing the whole thing, I would have her smell a bunch of stuff for all her sensories and all her cranial nerve tests. But I don't have that, so we're not going to do that. But you can smell,
yes.
Right? Okay.
Yes.
Any problems tasting?
No.
Okay, tilt your head back for me, stick your tongue out. I don't have a pen light, but we're going to pretend like her.
Hey, you want my flashlight on my phone?
No, it's okay.
I got one.
Oral mucosa is pink, normal for patient ethnicity. No signs of dryness. No. Do you have tonsils?
No. I had those taken out as a kid.
Yeah.
No adenoids either.
And then I'm going to pretend like I'm looking up your nose. Your nose is all fine. No issues there. No drainage. No postnasal drip.
I have bad sinuses, so I always have drainage. That's why my voice is kind of raspy right now. The leaves falling are one of my allergy triggers.
So pupils are equal and reactive. I don't have a pen light, but she does not have any neuro problems going on that she knows of, right?
Correct.
Okay. Ears are symmetrical on both sides, same size, even where they're located. And then any problems with your throat? I know you said you've got a little bit of allergies, but any trouble swallowing?
No. Recently I've been to an endocrinologist who has had to make some major changes in my medication because my prior family doctor was not treating my thyroid correctly. So we've had to make some major medication changes.
Hypo or hyper?
Hypo.
Okay.
Which I also have Hashimoto's, which has led to some skin rashes. If you see those as you get to my hands, I have some on my legs, some on my feet. Those are being treated by dermatology as a Hashimoto's reaction. But as my medication is corrected, those are lessening.
So obviously she's not in a gown. I can't look at her fully. You don't have any bruises anywhere that...
I have one right here on my arm. I just had some labs drawn for my doctor's appointment. And unfortunately, as labs are drawn, I usually bruise very easily. So
okay,
that's the only one I know of.
Other than that, patient does have scattered moles throughout. Have you ever had skin cancer?
No, but I just went 2 months ago to the dermatologist, and as she assessed the skin rashes, she did a full mole assessment, and there was nothing that caused her any concern.
Okay. I'm going to take a listen to your heart and your lungs, and then we'll move on down.
Okay.
Hands are probably cold, sorry.
That's okay. Oh.
So heart sounds good. S1 and S2 are heard. No abnormal sounds. Regular rate and rhythm. Alright, I'm going to listen to your lungs, so just take a deep breath every time you feel the stethoscope. I'm going to listen on the back. Alright, last one. Okay. Breath sounds are good, even, non-labored, clear all the way throughout, so no problems there. Do you have any respiratory problems?
I do have asthma.
Okay. Any recent problems with that?
Recently we were on vacation, and when we came back I did have like a cold flare up, which any colds or sinus infections always end up flaring my asthma a little bit, but it wasn't out of control.
Okay. So I'm going to take a look at your belly. I'll probably have you lay back for that. Any GI problems? Any
I had my gallbladder out. I forget how many years ago, but it's the continuing complications of no gallbladder.
All right, so typically I would look, but I'm not going to do that for her. But no problems, just some scars from past surgeries.
Yeah. It was a
lap chole.
Yeah.
So I'm going to take a listen. Abdomen, she's got normal active bowel sounds, no sounds of concern or anything like that, no bruise, if AAA. So then I'm gonna percuss and palpate, okay?
Mm-hmm.
I can't really do it because you have a shirt on. Oh, that did it. Any pain?
A little bit there.
Here?
Mm-hmm. I have a
hernia?
hiatal hernia.
Okay. Alright, I'm gonna just push you. Tell me if there's pain anywhere. Any problems with that hernia?
Sometimes it gives me a fit.
Okay. I'm gonna let you sit up.
Thanks.
As far as urinary goes, any problems with urination? Burning, peeing, trouble peeing?
I have a prolapse bladder that I'm being treated for, so I have oxybutynin that I take to help control the overactive bladder associated with that.
Okay, what about any reproductive problems?
I had a total hysterectomy years ago, so I don't have those.
Okay. So next we'll move down to your legs. Any problems with your knees, hips?
I have had sciatic before, so
Okay.
I tend to have some trouble with it. And associated with the back surgery I had a few years ago, I ruptured L4, L5, and had partial discectomy.
Okay, so just looking at her back, if she was not dressed, probably some scars, I would assume.
Yes, I have one right here at the top of my pant line.
Okay, any surgeries on your knees, feet?
I've had 2 arthroscopic surgeries on my right knee for what my ortho called a plica band.
Okay.
So he described it as something that should have gone away and didn't. Mine continued to grow. He went in one time and cut it, and the next time he had to go in and shave it to the bone.
Okay, so I'm just gonna feel down, make sure I don't feel any abnormalities. None on that leg. None on this leg. Alright, bring your foot up and touch my hand. Okay, now this one. Can you flex your feet out? Any problems?
No.
Okay. Any problems when you straighten your knees out and bend them like that?
No.
Okay. So I'm just gonna feel your...
I do also have the early stages of osteoporosis. It's osteopenia, I think it's called.
Osteopenia?
Whatever. I can't never remember what it's called.
Okay.
Sorry, I apologize.
So I'm gonna feel your pulses just going down. No problems there. No problems there. So I'm gonna feel this one first. Pulses are good there. I probably have to
I'm sorry.
take this off. Now here we'll just scoot it up.
It doesn't move well. There you go.
Pulses are good and equal there. For purpose of this, I'm not going to feel her femoral pulse, so I'm going to check her popliteal and her dorsalis pedis. I'll try anyway. Sometimes these are hard to find. I don't know, yours are easy. They're equal there, so your femoral should be fine. And then her feet, she does have shoes on, which I'm not going to make her take them off, but you'd feel on the top of her feet. So, no problem there. You don't have any edema or anything in your legs? Do you ever have problems with that?
Sometimes my legs do swell if you look. Yeah.
They are a little swollen down here at your sock line.
Yeah, at the end of the day, when I wear socks, you can notice the swelling.
Any problems with your kidneys?
One of my medications, they have to watch really closely on my kidneys. Meloxicam.
Okay.
Because I have very high inflammation markers. So they watch my kidneys, but my last lab work, my kidney function had improved some from the previous. So they just watch it really closely, but no problems at this point. Just
okay. So I'm gonna listen for a bruit at your carotid. Other than that, if I didn't mention it, her vitals were all fine and normal for a patient. So I'm gonna have you take a deep breath and hold it.
Okay.
So whenever you're ready. Okay, you're good. That side's good. We're gonna do this side. Okay. All right. Well, I think you're good to go.